Current theories and discussion about trauma define it as both the traumatic event and the reactions to it, called trauma reactions. Traumatic events could be accidental or deliberate. Examples include traumas that happen to groups of people, such as a natural disaster like this coronavirus pandemic or a terrorist attack, and also those traumas that happen to individuals, such as physical, emotional or sexual abuse of children. The organisation SAMHSA defined trauma as a single event, multiple events or a set of circumstances that is experienced by an individual as physically and emotionally harmful or threatening, and that has lasting adverse effects on the individual's physical, social, emotional or spiritual well-being. Trauma stress reactions can be seen as any experience that causes an intense physical and psychological stress reaction or the lasting effects from harmful events. Those in need of mental health, substance misuse or accommodation support needs have often been exposed to multiple traumatic events and tend to be at increased vulnerability of being re-traumatised through a pattern of chaotic life events, including how they are treated by significant others, including potentially re-traumatising treatment by services offering to support them. For example, repeated assessment and rejection from services can mirror the neglect and rejection people experienced as children, and so services have the powerful potential to be re-traumatising as well as potentially helpful. Trauma in early life and how these past experiences affect people's present and future life chances has been researched. One set of influential large-scale studies defines these early traumas as Adverse Childhood Experiences, or ACEs. ACEs studies define examples of childhood trauma as physical, verbal or sexual abuse, or growing up in a household where there's parental separation, alcohol abuse, drug use, domestic violence, parental mental illness, or imprisonment of one parent. It's important to acknowledge that neglect can have as much negative effect as active trauma. For example, if our practical and emotional needs for love and validation growing up are not met, then this can lead to low self-esteem, depression, or a general feeling of not being wanted and that the world does not have a place for us. In addition to past traumas and neglect, it's important to also consider current adversity will also impact and affect people, such as not having a home, a job, income, or being in an abusive relationship. And at the time of making this training, that's particularly important because there's this general coronavirus pandemic which is having an adverse effect on everybody's life, and it's a threat, so it's a traumatic experience that collectively we're living through. But people will have different reactions to the threat. People need their basic needs met, such as somewhere to live in order to feel safe, and increasing people's safety is one of the core principles of trauma-informed care. So when we define trauma, it helps to hold in mind past trauma and neglect, and also current adversity that people are facing. Although around 2 out of 3 adults report experiencing one childhood trauma, 9% or approximately 1 in 10 adults report experiencing 4 or more adverse childhood events growing up. Those people experiencing 4 or more adverse childhood experiences were found to be at a much higher risk of developing mental health, substance misuse or health-harming behaviours. For example, compared to people with no adverse childhood events, people with 6 or more ACEs die an average of 20 years younger and are twice as likely to binge drink and have a poor diet, 7 times more likely to be involved in violence in the last year, and 11 times more likely to use heroin or crack or have been in prison. Research such as the ACEs studies led to the realisation that on average people using mental health, substance misuse and accommodation or homeless services are people with generally high levels of past trauma. This led to the development of trauma-informed approaches to help improve the ways we work with people in general, and trauma-informed care is one such approach. It's also shown people vary widely in how many traumatic events they experience growing up and during adult life. It's important to hold in mind the severity, frequency, and types of traumas experienced varies in between people. The younger you are experiencing trauma, the number of traumas, and the length of time they went on for all make a difference. There's a wide range of diversity and difference in how people react to traumatic experiences. Two people may have very different reactions in response to a similar traumatic event. For example, some people might talk to an adult about it, whilst some others may not have an adult in their life that they feel that they can trust or feel safe to confide in. And so they may keep the experience of something traumatic a secret for years or decades. It's important to remember that often people react to trauma in positive ways as well, by processing and making sense of the traumatic incident, maybe by talking it through with someone that they trust. In this healthy, positive reaction to trauma, it has no negative ongoing impact on someone's future life experiences. However, sometimes people react to trauma in ways that are understandable at the time, such as drinking too much or changing their eating habits or self-harming, but these habits can become health harming and people can get stuck in these habits in the long run.